Welcome back to Face the Nation. We want to pick up where we left off with former FDA Commissioner Dr. Scott Gottlieb. We were talking about the projection by Dr. Fauci that you could have a rolling reopening of the economy by next month. What parts of this country have the systems in place or the ability to open up that soon?
Well, look, I don't think anyone's optimized really right now. We're not going to have the testing in place. We're not going to have the public health employees hired to do the effective contact tracing. So, there's no question we're going to be opening at some risk. I think that's inevitable. There's a lot of pressure right now from the business community on not just the administration, but governors as well to start reopening the economy. So I think inevitably we're going to see a slow reopening of business activities through May. With some risk, but there's always going to be risk. And if you ask public health officials like me what the optimal amount of testing is, the answer we'll give is more. But we're not going to be where we want to be. So I think you're going to see a gradual reopening where governors and mayors say, well, businesses can reopen, but you can only bring back 50% of your employees on any one shift. So you force employers to break up the shifts. Maybe you tell people over the age of 65 to stay home a little longer. You tell businesses you can't have meetings more than 10 people. You can't have conferences. So there'll be measures put in place to try to limit interactions at the workplace, but allow some work to get on.
The FDA has said it may approve a serology test. That's the test for the antibodies in your blood sometime in the next few weeks. What does that do to your timeline, and how widely available would that be?
Well, it may be widely available, but I think it's of marginal utility and impact for these kinds of discussions. What serology tells you is if you have circulating antibodies in your blood, if you've been exposed to the virus and you've developed some level of immunity. But I think when we actually do serology on the population, we're going to find the actual level of exposure across the population is very low, somewhere between maybe 2 or 5%, and I'd put it on the low end of that range. That's certainly the modeling of the data coming out of Europe, where they have anywhere from 2 to 5% of their populations exposed. If you look in certain professions, healthcare workers, police, people who work on grocery checkout lines, flight attendants, TSA agents, people who come in contact with a lot of people as part of their work, the rates may be higher, maybe on the order of 10% that have been exposed and developed some immunity. So you can make decisions in those professions to preferentially return certain people or put certain people on the front lines right away. But on the whole, we're going to find that a very small percentage of this population, certainly in the single digits, have actually been exposed to this infection. So the perception that there's 30 or 40% that have been exposed and develop immunity, it's not going to be the case.
We know that, this is a global pandemic. The president has said that he is reviewing U.S. funding to the World Health Organization. The U.S. gives about $100 million a year to it. They're leading the response around the world. What changes do you think need to be made?
Well, look, I don't think this is a time to defund the WHO, given the fact that I think this is going to become epidemic in the Southern Hemisphere and parts of the world that don't have resources to deal with this kind of a global issue. But the president raised a lot of valid concerns. China was not truthful with the world at the outset of this. Had they been more truthful with the world, which would have enabled them to be more truthful with themselves, they might have actually been able to contain this entirely. And there is some growing evidence to suggest that. As late as January 20th, they were still saying that there was no human-to-human transmission, and the WHO is validating those claims on January 14th, sort of enabling the obfuscation from China. I think going forward, the WHO needs to commit to an after-action report that specifically examines what China did or didn't tell the world and how that stymied the global response to this. I also think they need to embrace Taiwan's role in the global health community and allow them to attend the World Health Assembly. Right now, they've frozen China out. The WHO has at sort of the behest of China. And that's hampered the global response because China's been a very important partner. To give you just one more anecdote, China didn't share the viral strains, and the WHO should have made them do that. Had they shared those early on, we could have developed a diagnostic test earlier, validated it earlier.
Well, we will see what the president decides to do in the coming days. Dr. Gottlieb, as always, thank you for your time.
Thanks a lot.
One of the models that the White House is watching closely in terms of hospital resources and what the death toll could look like going forward is from the University of Washington's Institute for Health Metrics and Evaluation. You often hear it referred to as the IHME model. The director is Dr. Christopher Murray, and he joins us this morning from Seattle. Dr. Murray, good to have you here. What would a rolling reopening of the economy look like, and what would that do to your projections?
Well, we've been trying to investigate that because I think the issue is if you open up too soon and there's a big load of cases still in the community that have the potential to go back to community transmission, we can quickly see resurgences in some states. So some states, it's possible in May, but in other states, it's going to be very unlikely that that would not lead to an immediate resurgence.
Which states are safe to reopen?
Well, what we're seeing is that the states, such as out here on the West Coast, seem to be farther along in the epidemic, peaking, and then we need multiple weeks of closures after that peak to bring the burden of cases down to the point where testing and contact tracing has a chance of working. And then, of course, there's the big issue: if states are on different timings of their epidemics, which we know is the case, how are they going to control importation from other states into their state? So it poses a whole series of new questions that haven't yet really been addressed.
You know, this week your model projected that around 61,000 Americans will lose their life to the virus by the end of this summer. That is a breathtaking number, but it is far lower than your April 2nd estimate of nearly 100,000. Your discrepancy there has been heavily criticized. I'd like you to explain why there was such a significant change.
Well, about 2 weeks ago, our first prediction was about 80,000 cases with a very wide range from about 30,000 to 150,000. And all of our subsequent forecasts have been within that range. What the advantage of the model that we run, which is we keep updating it, 3-4 times a week, is that it's driven by the data. And so the trend up in some states has been faster. In New York, for example, at the beginning, that pushed our forecasts up. And then the trend, the peaks that we're seeing in California and Washington have been lower than expected. And that's brought these forecasts down a bit. But they've all been within the same range. We're now, the last series of forecasts have been around 61,000 deaths. We predicted the peak about now, and that seems to be occurring at the national level. But because of incomplete implementation of social distancing closures in many states, it's adding a degree of uncertainty about what's actually going to happen in places like Texas, as an example.
Texas is a hotspot that worries you still?
Well, all the places where we have only partial closures, for example, on the essential business list, those are the ones that it's really much harder to know what's going to happen. Okay. We have rock solid evidence that the full closures work. We've seen that in Italy and Spain. We're seeing that out here, out west. But what we don't know is, do these sort of incomplete closures have the same impact?
You know, Dr. Fauci likes to say that a model's only as good as the assumptions you put into it. I believe your models assume that social restrictions stay in place until the end of May. So if you start reopening parts of the country, how high of a risk of rebound is there?
If the first testing we've done on this is if you opened up the entire country May 1st, then we would very clearly have a rebound. We don't think the capability in the states exists yet to deal with that volume of cases. And so by July or August, we could be back in the same situation we are now. I think what Dr. Fauci was talking about this morning is that different states are on different timings. And so maybe some states can open up mid-May, but we have to be very careful and make sure that we don't sort of lose all the effort that the American people have put into closures by premature opening.
And this is a global pandemic. This could be a seasonal virus. Where are we as a world right now?
Well, that's the really big question. Most of our work at the Institute is actually focused on tracking health around the world in a thing called the global burden of disease. So we're used to looking at all the data around the world. And the big worry is what will be the toll in places in the low and middle income world that don't have the capability perhaps of implementing social distancing measures. They don't have the ICU capacity. They don't have the ventilator capacity to deal with patients. And that's what I think many people are trying to focus their attention on now. What's coming down the pike?
Doctor, thank you for your analysis. We will be right back. We turn now to Neel Kashkari, President and CEO of the Federal Reserve Bank of Minneapolis. He also led the Treasury Department's 2008 TARP program. He joins us from Minneapolis. Thank you for joining us. Clearly, you know what a crisis is like and how to navigate one. I want to ask you about the jobs crisis right now, because 16 million Americans have filed for unemployment since these restrictions went into place due to the virus. The St. Louis Fed says we could see 47 million Americans losing their jobs. Where is your prediction of a bottom?
Well, we just don't know. I've been listening to your program this morning, Margaret, and we just don't know the path of the virus. That's going to determine how long the shutdown needs to take place, and ultimately how many Americans lose their jobs and how quickly we can get them back to work when the economy turns back on. So there are wide ranges of estimates of how wide or how high the unemployment rate is going to go, but it's all driven by the virus and how effective we are and the healthcare system is to catching up and to controlling it.
So these estimates or predictions of a V-shaped economy, that the economy is just going to turn right back on when people go back to work, is overly optimistic.
I think so. It would be wonderful if some new therapy were developed in the next couple months, that people could have confidence to go back to work, that they could get treatment. Then potentially we would have a V-shaped recovery. But barring some healthcare miracle like that, it seems like we're going to have various phases of rolling flare-ups, as we heard from your guest from Washington, different parts of the economy turning back on, maybe turning back off again. This could be a long, hard road that we have ahead of us until we get to either an effective therapy or a vaccine. It's hard for me to see a V-shaped recovery under that scenario.
Well, it looks like Congress and the administration underestimated the amount of pain small business owners are in. There are predictions that the $350 billion put aside could be exhausted, and that's why Congress is talking about adding another $250 billion. They're fighting about it, at least. What will the impact be if Congress doesn't make that package bigger this week?
Well, I think it's very important. A lot of small businesses are saying they want to keep their business together. They want to keep their employees employed, which is really, really important so that we don't have even more job losses. So that's good. The banks are trying to step in. The small businesses are trying to do their part. But we know that the $350 billion is not going to meet the needs across all of the small businesses in America. So it'll end up being first come, first serve, who end up getting the assistance and who's left on the sidelines. I'm optimistic. I think Congress will come together to provide more support to small businesses. But then again, we don't know if this support is going to be long enough, because if we need to have different phases of shutdowns for the next several months or until we have a therapy or vaccine, they're going to need more help than that.
Right, and the Fed is part of this strategy because, as we detailed this week, there are about $2.3 trillion in loans that the Federal Reserve, that you're part of, could issue to businesses, to states, and to local governments. You said in the last crisis that the mistake was going sort of too small and being too timid. This time around, is there enough money being thrown at this problem?
I think there is, in terms of what the Fed can do. I think our chairman is being very, very aggressive. He's learned from our experience in 2008, and the whole Federal Reserve is being as aggressive as possible. That's the right thing to do. I think Congress is also being very aggressive. But again, it goes back to the progression of the virus. If we're going to have economic distress until we have a vaccine, then it's going to be up to Congress to keep coming back to provide support to the American people. We can't shut down the economy for 18 months. But we need to find ways of getting the people who are healthy, who are at lower risk, back to work, and then providing the assistance to those who are most at risk, who are going to need to be quarantined or isolated for the foreseeable future. That's a real challenge for all of us.
Your colleague, James Bullard of the St. Louis Fed, was with us last week, and he said that the answer lies fully in technology. It's testing and surveillance, getting people before they walk into their employer to have a test and wear a badge. I mean, is that your guidance here too?
Well, I would love it if that were possible. I've talked to some healthcare experts who say that it's a fantasy that we're going to be able to test tens of millions of people every day, that there simply is not the equipment, there's not the supply chain. I hope they're wrong. That's a real concern. I don't think we should put all of our eggs only in the mass testing basket. We should try to make that work. We should also invest fully in vaccines, fully in therapies. But then I think we're going to need to be smart about how we start to reopen parts of the economy with those who are at lowest risk until that capacity and that testing and those vaccines and therapies come online. I think we need an all-of-the-above approach because we don't know where we're going to have the breakthrough.
Many Americans this month had to suspend their mortgage payments. They just couldn't pay because of what their reality is And I know Jay Powell, the head of the Federal Reserve, has said they're watching carefully the mortgage servicers. What is the degree of risk here that we are looking at some kind of housing crisis, financial crisis?
Well, we know that ultimately, if this goes on long enough, these losses roll up into the banking sector. People don't pay their mortgage. A coffee shop doesn't pay their landlord. The landlord then can't pay the bank's mortgage. And so it ends up rolling up into the banking sector. Right now, the banks are well capitalized relative to where they were in 2006. But if this goes on long enough, it could produce strains in the banking sector. And then the Fed and Congress and Treasury would have to step in to make sure that the banks are sound. So it's something I think we're all watching very closely.
When you say long enough, what is the timeline that you're worried about?
I'm focusing on 18 months because we're looking around the world as they relax the economic controls, the virus flares back up again. And that makes intuitive sense because so many people have the disease, but they don't show any symptoms. So you don't know who's spreading the disease and who isn't. So we could have these waves of flare-ups, controls, flare-ups and controls until we actually get a therapy or a vaccine. I think we should all be focusing on an 18-month strategy for our healthcare system and our economy. If it ends up being shorter than that, that's great. We should prepare for the worst case scenario.
All right. Neel Kashkari, thank you for your insights. We'll be back in a moment. The Easter and Passover holidays are a little different this year. For a look at how some Americans are finding solace in faith, we go to the Archbishop of New York, Cardinal Timothy Dolan. Cardinal, thank you for joining us.
Margaret, a blessed Easter to you and your listeners.
Thank you. This is Easter week. It is Passover. It will soon be Ramadan as well. How would you counsel people to observe their faith while in isolation?
Well, you use the word faith, and that's key. Faith, of course, doesn't depend on things physical. And we have faith these days that even though we can't, sadly, get to the synagogue or to our parish churches, we can still be in union with God through prayer, through sincerity, through earnestness, through charity to others. And thanks be to God, so many are using the technological advances that we have, live streaming, radio, TV, you name it. People are plugging in at overwhelming numbers to be part of a community at Easter and Passover.
You are the Archbishop there, as we said, of New York. That means that your diocese, you are administering to the people right at the epicenter of this outbreak there. And I think one of the most painful things that I can think of is all those families who cannot hold funeral services, hold all the rituals for the people they just lost. We saw those pictures from New York of mass graves. These are things you see in war zones you don't see in the richest country in the world. How do you grieve without that ritual surrounding death?
It's difficult. Just as you have faith that the person you love is still enjoying eternal life and is still with you, so our faith needs to kick in that even if we can't be next to mom and dad or grandma and grandpa, and even if we can't embrace the family at a time of mourning, our faith tells us we're still united, we're still together. I've experienced it myself, Margaret. I've had to bury a number of priests and people at graveside, and I say to them, you know, your grief is complicated because not only have you lost someone you cherish, you were even unable to be next to them in their last moments, and you're unable even to mourn and cry and hug one another here at graveside. This is an extended, enhanced, deepened sense of grief, which I hope, whenever we got that loss, whenever we got that emptiness, you know who wants to fill it? God. So I'm hoping it's an invitation from Him that as we're empty, He will fill.
Pope Francis gave an interview recently, and he said about the virus, it's a time for integrity. What does that mean from a social justice perspective? What is he asking people to do?
You know, integrity means a connectiveness, that what we believe deep down inside is mirrored in the way we act, okay? That's integrity. The opposite of integrity is disintegration, when our life falls apart because there's a division, there's a fracturing between the inside and the out. The Holy Father's asking us to integrity. You see it You see it when people discover an interior strength. And they're telling me that, Margaret. They're saying these days I'm alone in my apartment. I'm missing all the things I usually count on. And yet I've discovered deep down within a resilience, strength, and virtue and talent I didn't know I had. I'm discovering the warmth and tenderness and love that I have for family and friends, even though I can't be with them. And they'll tell me I'm even rediscovering a faith that had grown somewhat dormant as I'm sensing God's presence and talking to him and feeling his consolation. That's an integrity when things come together, and when that flows out to the way we love and treat other people, as we see so radiantly all over in our healthcare workers and our first responders and in neighbors who are looking out for one another, shopping, checking on one another. I think we've got an integrity, a connectiveness, a unity of purpose, and I'm rather confident that's what Pope Francis meant.
There still is no vaccine to stop this virus, even when we get through the worst of it. How are you going to reopen church doors? Are you going to keep the social distancing? And for someone this morning who wants to get in their car and go to any denomination to worship, what would you tell them before they make that decision?
Well, God gave us common sense, and God told us we have to pay attention to the common good. The decision that I would make about opening our churches, and please God, it's as soon as can be, is that we have to listen to the experts. We have to listen to the physicians, the scientists. We have to listen to our civic officials, because they're on top of things. And we're people of common sense. God gave us a brain. And part of the way he answers prayers is in the direction, the guidance, the illumination that we get from other people. When they tell us we can go back, and when those medical experts offer some ways that perhaps, at least until we're sure this virus is behind us, we can protect one another, that'll be the time to go. And that's what I say to God's people who today are really missing. They want to get in the car and drive around till they find a church open. God is telling us, use your brain, use your prudence, use your common sense. Don't tempt the Lord.
Cardinal Dolan, thank you. Happy Easter.
Thank you, Margaret. A blessed one to you and your viewers.
We'll be right back. If you're like us, you feel a bit helpless these days when it comes to seeing so many fellow Americans struggling, especially on this holiday weekend. So all of us at Face the Nation leave you today with some ideas for how you can help.